This is the first year where I've seen the American Board of Orthopedic Surgery recommend PRP injections as highly, if not slightly more highly, than something called viscosupplementation injections, which are the lubricant injections or the gel injections or the hyaluronic acid injections, which we do quite a lot of. It's covered under health insurance plans. Patients come in and then a large percentage will get 6 months of relief or longer with these viscosupplementation or gel injections. And so there have been countless and numerous studies all around the world comparing these gel injections to PRP, which is platelet-rich plasma. Platelet-rich plasma, an injection we give that comes from your own blood. We draw it from your vein, usually in your arm. We place it in a centrifuge, we spin it down, and in layman's terms, we take the platelets and remove the red cells, and those platelets, which is concentrated plasma, get re-injected into the area of the problem, whether it's a knee, whether it's a shoulder, and they decrease inflammation, can potentially promote tissue healing, and is a safer alternative to injections like cortisone, which we also do, and there is still a need for at times. So patients come in asking the pros and cons of PRP versus the gel injections, and that's certainly a conversation that I have quite a bit. In regards to stem cells, still considered a pretty new technology, and at least from an orthopedic standpoint, there's just not enough data out there to say consistently that a blanket statement that stem cells work or stem cells don't work. It's just still being studied. And because there are so many different processes and so many different stem cell options, it's really hard to guide a patient on stem cell these days. And what I tell them that is, there is some literature to support it, there is some literature to say that it doesn't work. It is unfortunately expensive and sometimes cost prohibitive. There are potential side effects with stem cells, although I do believe they're low. Patients need to understand that that is part of it as well. And if they're comfortable doing it, or they've had family members that have had it and had good results, I certainly don't turn them away from it, but it's just something I'm honest with them and telling them that the data on stem cells just is still in its early stages. And I think it's going to be definitely part of the future of medicine and orthopedics, and improving soft tissue healing, potentially even bony healing and other aspects of it. But that's still the work that we continue to follow every year. So patients come in very educated right now on the different types of injections, from cortisone to PRP to stem cells to other alternatives. So that's certainly something that I talk about quite a bit. So I had PRP myself. I had golfer's elbow about 13 years ago, which is a tendonitis on the inside of your elbow. And I had tried cortisone injections from my partner. Each of them worked, and about 6 weeks later, I was right back where I started. Fortunately for some people, cortisone works well and it's a one and done, but for me, it kept coming back. So at the time, PRP was sort of just getting its technology under its belt. And I had an injection, and at about 6 weeks, I was 50% better. And at about 3 months, I was 80% better. And then at about 3 or 4 months, my pain was gone. So that's kind of what I tell patients might be a reasonable expectation, but having done so many since then, I have seen a wide variety of responses to where some patients within a week or two say they feel wonderful. I've had other patients certainly that it takes that 4 to 6 weeks, which I think is probably the average. If we're talking about your body going through its natural process of healing, which PRP stimulates that natural process, you can imagine a lot of things do heal in 4 to 6 weeks, like an ankle sprain or a strain to a muscle. Those things take about 4 to 6 weeks. So if PRP is sort of initiating or augmenting that process, I think a 4 to 6 weeks time frame is pretty reasonable. But I've definitely seen patients get better faster or slower. And certainly if we had the opportunity to use PRP more easily and more often, most of us have seen the results personally to utilize PRP for multiple reasons. So there are some doctors out there that will promote a 3-injection series or a 2-injection series. I'm not aware that that's necessary or backed by research. So my personal philosophy is, let's try one, let's see how it works. And if one works and you plateau with 40%, 50%, 60% improvement, and it's been 6 to 8 weeks and you want to try a second one, I have seen good results with the second one in addition to the first. But for the patients where I've given them one PRP and at 6 to 8 weeks, they say, I feel great, I don't offer them a second injection. I say, well, call me if it comes back. And most patients don't. So I think it is possible for one injection to just work and be done with it. Worked for me, and I certainly would talk to patients about the pros and cons of one versus repeated injections as well.